Hi, I'm Dr. Harald Lausen, the Chief Medical Officer for SIU Medicine, and today I'm joined by Dr. Aziz Kahn, the Director of the Simmons Cancer Institute. Welcome and thanks for joining us today.
Thank you very much for inviting me.
Absolutely. So today we wanted to talk a little bit about our patients that have cancer diagnosis or being treated for cancer. And I know there are a lot of concerns out there. So let me just start with a very general question. What are the things that our cancer patients need to know? What are the special precautions that they need to follow? And what's important for them to understand about their medical care?
So I think that's a critically important question. And what we emphasize is all the basic precautionary measures that have been put forth by CDC and other entities. So hand washing, sanitizing your hands, avoiding crowded places, staying at home. But for the cancer patients, it's that much more critical because they're also immune suppressed. And we feel that these patients have to be more stringent in their isolation. Now, the one thing that we do want them to keep in mind is that their cancer diagnosis makes them more vulnerable to a multitude of factors. The most important of them is the cancer itself. And so in this whole process, we should not neglect treating the malignancy because of fear of COVID-19 infection. We are taking very stringent measures to protect our patients when they come in for their clinic visits and when they get their chemotherapy. And these measures are over and beyond what CDC has recommended.
Right, so at the Simmons Cancer Institute, the measures that are put in place there are the highest in our whole environment, the highest at SIU Medicine, to make sure we're taking special care for our patients that have a compromised immune system, that have a cancer diagnosis, that are receiving chemotherapy.
That's definitely true. And we actually implemented those measures a week to 10 days prior to the general recommendations of masking by CDC. In discussions with you, in discussions with other people within SIU, we made the decision to wear masks and to have our patients wear masks when they come into the cancer center. We also started monitoring them with questions as well as taking their temperature. And then we extended it to all the nurses and the physicians who are taking care of these patients. So these are very stringent measures. They not only self-monitor themselves, but we monitor them as they come in the morning to take care of the patients.
And you brought up the idea of masking when we're seeing patients in the office. Do you have any recommendations for patients wearing a mask in public? Obviously, we want them to stay at home as much as possible, but how important is it for our patients that have a diagnosis of cancer or being treated? How important is it for them to wear that mask?
I think it's very important. And what we feel is that masks work in a couple of ways. And the most important is that it contains secretions as you speak, sneeze, cough, thereby reducing the risk to people around you, and thereby also setting a trend where others will do the same, hence protecting every individual in a grocery store or a place where you must go, like a pharmacy. And I think the wearing of masks protects everybody around you, and we highly recommend it.
Right. So if you're unable to stay home, if you need to go out, a pharmacy visit might be one of those things. You have to be real careful. Make sure your social distancing is there. So at least 6 feet. We're hearing a lot of reports now that maybe even farther apart would be a good thing. So for our patients with cancer undergoing treatment, that social distancing 6 feet or greater, along with the mask in those public places, is really
It is critically important. The other thing that we recommend our patients is that when they go to the gas station to fill up their vehicle, that they use a protective covering over their hand, and if they can't find anything, a good glove that they can just utilize for that purpose should be used. Remember that on some surfaces, COVID-19 can stay active for 48 to 72 hours, and hence we do want them to take these minimal precautions. Also have a hand sanitizer in car where they can clean their hand after they take the glove off.
Right, so that cleaning the hands, hand sanitizer, really for any time you're touching objects that other folks have touched, you want to make sure that you're keeping your hands very clean.
Absolutely, and the first order of things is to wash your hands. The routine washing technique has been discussed multiple times, but you have to wash your hands, lather up, and do the back and the front for at least 20 seconds before you rinse.
Right. Okay. There have been some other questions about how we're seeing patients, and how is SIU Medicine seeing patients now, both in the clinic but also in the hospital?
We are. So we have an oncology service that takes care of inpatients, and we are seeing every patient that needs to be seen. If we are consulted, we will go and see the patient and give our recommendations. And that is the same as we were doing before the days of COVID-19.
Right, so the hospital service is exactly the same before COVID as after COVID. If a patient needs to be seen, there's a consultation or an issue that needs to be dealt with by the oncology service, you will see that patient.
Correct.
And then how about in the outpatient setting? How are we dealing with our visits now at the Simmons Cancer Institute? How are we seeing patients? Are we doing in-person only? Are we doing telehealth visits? Are we doing virtual visits, phone calls? What are the ways that we're seeing our patients?
So we are doing all of the things that you've mentioned. What we've done is individually we've gone through our schedules, and we have sorted patients out as to those that must be seen physically, and these patients are being brought in and seen in clinic. The precautions that we are taking is that at any given time in a clinic space, there's only one oncologist seeing his or her patients. And that reduces the number of people in that clinic, thereby reducing the risk to the patient. So we will have a nurse, an MA, and the physician. Everybody's masked, everybody's gloved. Patient comes in, gets put in a room. We do not let these patients wait in the waiting area because there's a single physician and we've got 8 or 9 rooms. We can put individual patients into the rooms, thereby separating them and not letting them mingle in the waiting area. So it's very, very safe. As I've already mentioned, all our faculty as well as nurses and staff are monitored both by themselves and by us. We also question our patients, making sure that anybody who has symptoms concerning for an upper respiratory tract infection does not come in without getting properly evaluated by their primary care physician, thereby preventing any risk of a patient bringing in an infection and infecting others. We also see patients virtually. So those patients who have a 3-month or 6-month follow-up visit, these are patients who are beyond their chemotherapy and who are only being seen in follow-up, have had some scans done, which we feel can be discussed through a telehealth visit. We will do that. In some situations, there are patients that have benign hematologic conditions like anemia, thrombocytopenia, or low platelets, not to a critical degree. We are delaying their visits and we'll see them if this thing does not resolve over time. But what we are doing is spacing them out so the exam rooms and the waiting areas are not crowded.
Okay. So for folks that have the blood disorders, maybe not a cancer, but some other type of chronic but manageable condition, if we can postpone or expand the time in between visits, we're doing that. We're touching base with our cancer patients who are stable and past sort of the active treatment phase, and then we're bringing in the patients that need to be seen for evaluation. And as you've described, the environment now is as safe as we can make it.
It is tremendously safe, and our infusion area is treating all the patients that require chemotherapy.
Okay.
They are being treated just like they were before the COVID-19 pandemic. All we are doing is we've distanced the patients, so there are fewer people in the infusion area at any given time receiving chemotherapy, and all stringent measures are taken to safeguard them from a droplet infection.
Okay. All right. How about I think some patients are concerned that if they get a new diagnosis, I have a new cancer diagnosis, I've not been seen by an SIU oncologist. And I know we talked a little bit about the hospitalized patient, but what about those patients have a new diagnosis, they're out in the community, and they need to see an SIU oncologist for the first time?
So we are seeing those patients, and the one good thing that has happened is with our clinic schedules being somewhat thinner than they were pre-COVID-19, those patients are being seen within 2 to 3 days of us receiving a consult.
Okay, so rapidly getting new patients in that have gotten a new diagnosis, and we're seeing them.
Correct.
And we're making sure that they're getting the treatment they need.
So we will physically examine them, make sure that all the appropriate lab work and scans are reviewed by us with the patient. A management plan is made, and then as they start their chemotherapy, we will then see them in the infusion area. Nurses will evaluate them. If the physician has to come and evaluate them, we will do that. Otherwise, we will see them through telehealth before each chemotherapy, and every second chemo we'll physically see them if need be, or sooner if there are any side effects that need to be addressed.
Okay. Another item that I think is important, and we talked a little bit about this beforehand, is what are the key things we need to tell those patients that are out there that are worried about coming in? I'm a cancer patient. I should be seen. I know I should be seen. I'm worried about coming into the clinic. What do we need to tell those patients?
I think the critical thing is that we need to look at the danger at hand, which is the malignancy that has already been diagnosed. The risk of COVID-19 is always there, but as I've mentioned, we have reduced that risk significantly to the point where when I come to work, that's the least of my worries. The most important worry and concern I have is the patient's well-being, how they're being treated, and we want our patients to feel the same. We will do our utmost to protect them against any kind of infection, but we don't want them to neglect their malignancy and die of a treatable disease because of fear of contracting something that they may never contract.
So I believe we've gotten through all of the questions that we had prepared. I was wondering if there's, and we've talked a little bit about the importance of people really understanding treating their active cancer, the malignant cancer especially, is important. We've created a safe environment, reduced all of those risks regarding COVID so that they can still be seen. We need to see those patients. They're what we call urgent or needed visits or follow-ups. And so certainly we want to see all of those patients. Is there anything else we need to inform the community about?
I think we need to reassure them that utmost care is being taken, and they are the most important person, in our opinion, in this whole setup. and you know, their safety is paramount. So I want them to be reassured that all precautions are being taken for their safety and for the safety of their caregivers.
That is very important. Dr. Kahn, thank you for joining us
You're
today.
welcome.
Hopefully our patients in the community, the patients we serve, will see this message and understand the importance of the particular treatments that we want to make sure they're continuing to receive. So as always, we thank you for watching our video, and as always, stay well, stay apart, and wash your hands. Thank you.